Hello there, my name is Eliud. I'm leading a team of narrators. We are working on an experiment to find out what happens to narrative workers. And narrative workers are people who work in processes that bring about justice and empathy around the world. Some of those are doctors, psychiatrists, journalists, teachers, morticians, mentors, and many others. And it is assumed that these people do not go through mental stresses because they work around helping those who have mental issues. And therefore, in this experiment, we are trying to talk to the narrative workers to hear what is in their mind. And they are saying that they too deserve empathy. Journey with us as we hear what is in the narrative worker's mind.
I'm a person living with substance use disorder and the founder and director of Nakuru Drop-In Center, where we take care of addicts in the community. And at the same time, I was a caregiver to my husband, who succumbed to cancer 1 year ago, and I took care of him for 5 years.
I'm a psychiatrist. I also am teaching in the university at Moi University. That is my primary employer, where I teach in the Department of Mental Health and Behavioral Sciences. I've lately also been teaching as an adjunct with Egerton University at their medical school, and I also teach psychiatry there. Over the last 4 years. I've been teaching at Moi University since the year 2005. Before that, I had worked at Madari Hospital in Nairobi for 2 years, and actually I had been there for training for about 3 years earlier. And I also had a chance of teaching at the University of Nairobi as an honorary lecturer for a period of 2 years there. That is whom I would say I am professionally. I do a little bit of private practice, not much, in Nakuru and also in Eldoret, and I enjoy my work.
I'm a husband to one wife and a pastor too. That's all. Yes. I'm also serving as the Secretary for Kenya Counseling Psychologists Association, Nakuru County Chapter. That's where I'm serving currently. Yeah, as the chapter secretary. Yes.
I always work with the community, and what I mostly do, I'm the founder of Family Life Initiative Program, a program which I started in 2011 due to issues that was in my community. In 2020, we started talking to the school-going children because of COVID-19. We were training them, or we are giving them information about reproductive health, because at that time the children were not going to school because of the COVID-19. And as a community health volunteer, when I visited my facility, a lot of young children or young girls were pregnant. So we saw it good to start talking to them. We had by then around 90 girls between 15 to 20, and we trained them on how to keep their safe from sex or to pray safe sex. After that, we saw a lot of girls were pregnant, and we started this organization so that we can help those young girls as young mothers to train them on life skills.
How do I take care of myself? Number one, self-care is, I take it as something that a must to any service provider. One, I make sure weekly I have my personal rest. I put off my phone at least. The earliest I can put off my phone, my earliest time to put on my phone is at noon every Friday. And then I also have my personal therapist, my supervisor, Dr. Gatwa, who I always visit him twice per month for my self-care. I also take time out just to go and have fun with my family. That's part of my self-care. As a reverend, that's where the challenge comes in. Because sometimes you are out with your family and they just come in. It happens that as a reverend, I have my day off. And sometimes my day off is just for hours. Because I find people have needs, they don't regard that day off. But I have scheduled myself to be very strict with my day off, at least a half day, that I have my personal time to rest and a day for my family.
Actually, that's a great challenge to me, but I thank God I'm connected to so many people. So when I have issues that are burning me, I normally call one of my network comrades who volunteer also to care for me.
In the evening, I come out to the near market. I can take one for relaxation, and then I interact. Sometimes there is sport. We go to play football, and then the day ends. Yeah.
There before we used to go, I used to go to an organization called PDO. That's where we used to have debriefing. And but as per now, 1 year down the line, I have not gone there. What I did, we organized ourselves as the cowgirls. We call ourselves cowgirls family or cow family. What we normally do, the cow family, after every 3 months, we go somewhere or maybe hiking, dancing to our country music, and doing things together as a team. That's what has been keeping me going.
You realize most care providers forget to take care of themselves. In any case, the kind of service that we offer is often a service that we may not be able to afford in the event that we fall sick. And so it's therefore important that we make every effort to ensure that we are well. So what do we do? Sometimes you will have to take care of your physical health first. So you ensure you eat well, ensure you exercise. Like I can tell you, I run every day for an hour every morning just to keep fit. Ensure you eat the balanced diet, and ensure, importantly, that you have enough sleep. Oftentimes people forget to sleep, especially the tradition that we inherit from medical school where you have to read for many hours. But once you graduate, you must remember that sleep is important. You also must have a circle of friends who you can rely on, with whom you can exchange ideas, you can share your experiences, because there are many challenges that you meet in day-to-day life as a professional. We do carry burdens for people, the emotional burdens, and unless you know how to offload these burdens, then you'll be having challenges through and through. And so those are some of the things I do.
The society we come from have never actualized the intermarriage between counseling psychologist as a profession and ministry as a calling. Now, but you realize these two cannot be separated. They are inseparable because they have to work hand in hand. The society views us as superhuman people, but I want to remind them to understand that we are human beings. We have our own lifestyle. We have just the same lifestyle that, like what they have. But the challenge is they have elevated us to a point whereby they think we are just there to give solutions. But we also need these people in our lives. When we are down, we need them to hold us. And that is something maybe has to be seen through, because it has to be followed up to. That's a gap in our profession and also in our service as ministers of the gospel. Because people think that we have a solution for everything, yet we have problems even ourselves that no one comes in to resolve or come in to hold our hands to walk with us through the process.
That is a question that I have to answer from a perspective of before I became a psychiatrist and the period that I have been a psychiatrist. Remember those old days, and I suspect it still does happen, we used to see psychiatrists as doctors of mad people. In Kiswahili, madaktari wa machizi. And so it became an issue even at medical school level of how do you decide to be a psychiatrist when in fact you also have been talking negatively about the psychiatrist. We have heard words like these people are just like their patients, they behave the same way, and so they generally will stigmatize you. And some people therefore would fail to introduce themselves as psychiatrists or even mental health workers. And that's one thing I have consistently been doing throughout my professional life, that I introduce myself appropriately as a psychiatrist without fear, because then you create confidence in the people that you are introducing yourself to. Then they will be like, okay, so he introduces himself as a psychiatrist, then psychiatry might be something good. And then of course you take time to explain to them what psychiatrists do. That is one of the things that many people don't know. And unfortunately, sometimes even our colleagues in mental health do not understand sometimes what is the scope of psychiatry work. And so you'll find that they will deny patients an opportunity to see you just because they feel like this is not the right kind of person or specialist to see the patient. And so they will be expecting that you'll only see the ones they consider mad, they are not able to take care of themselves, and yet you have a role in preventing it to reach that point. You have a role in management of neurological disorders and other behavioral disorders, and also a few physical conditions that affect our mental health in general.
They have not accepted us as other workers. For example, if someone questions me about what is your work, if I tell her or him I do mortuary, I work in mortuary, you'll see them just backing off from you. There is that stigma is there.
Number one, the community think that I have a lot of money. That's why I'm doing what I'm doing. Maybe having an organization like this. Others think that embrace this organization. They see that when I give the young mothers life skills or skills, they see as a turning point to the young mothers. I'm trying to help those mothers, and they take it positively.
They don't understand. And many of them actually can make you withdraw from what you're doing. Others think we are after money, or after fame, or after something, but what we do is to save soul. Like I met my husband 5 years ago, and when we met, he had a swollen neck. And I used to wonder, what is this? And one day I just told him, let's go for a checkup, because he used to think it's sore throat. And every now and then he'll take lozenges, and it became too much. And you can notice by the sound of his voice. So I told him, let's go and see a friend of mine. She has a hospice in Nakuru called Elizabeth. Let's go to her place. We find a medical perception on what you're undergoing. And that is how we discovered he had cancer. And ever since I've been with him, taking care of him until the day he died. The journey, my journey, if I tell you, I even wonder how I managed to persevere all through. First, we were jobless, me and him. and we were both volunteers, so we will survive on stipends. Secondly, my faith doesn't allow, my church that is, doesn't allow you to stay with a man unless you're married. And they also excommunicated me because I was living with a man in the house. But they didn't understand I was taking care of him because he had nowhere to go. Yeah. And I could not chase him away because of faith. So me, I just told them, after I've taken care of him, I'll come with him to church and you'll get to understand what I was doing. My family also, we had friction. How come you're staying with a man? Because, by the way, my family are the ones who are paying for me, my rent. So I've brought in another person, and then they're wondering, why should we pay for you? Why can't his family pay for the rent? Actually, it's just the grace of God that we managed to survive all those years with Peter. Because I go left, nobody understands. I go right, I go east, I go west. But it wasn't easy. I still stood by his side until he died. Peter was also a psychologist and a recovering addict. So we had a lot in common. That's how we managed to sail along together. So we used to work with him. Unless he's on chemo or he's not feeling well, he was also a strong man. If we had an outreach or counseling sessions, AA meetings, he'll come and you wouldn't even know he's sick. He'll take over and do everything like anybody else until now the day he's supposed to go for treatment or relax for the chemo to take over. But we did all along together very well, even traveling, even going for training, NACADA, ICAP, we were always together. Actually, where you see Peter, you'll see Kate. We never used to leave each other. Yeah.
One event that I will never forget, when my fellow mortician went for surgery for some legal mass, which was around here, and he died in theater, and he was brought to me to attend him. That was the incident that I will never forget. Emotionally, even when I went in my house, I was not like, I didn't want to talk with anybody until my wife realized there was something wrong. Then I explained the reason. She had to comfort me somehow, and then, but the memory remains.
If I say no, I would be lying. Because we see persons who are physically and psychologically traumatized, and sometimes in spite of your training, you are unable to completely separate yourself from the pain that these people are going through. And sometimes you may see a child who's been sexually assaulted, and suddenly you start seeing them as your own daughter or son, and the emotions that it elicits in you now become much different from what an ordinary doctor, psychologist, or even psychiatrist would be feeling. Or you'll even find an adult who is assaulted, and to them you are like, oh, this could be my brother, this could be my sister, this could be my father, and once your mind switches to that kind of thinking, then you find yourself getting embedded into that kind of traumatic event. And at that point, you have to do at least two things. Try to get help for yourself, and try to get help for the client, because once you are engaged in that kind of manner, then it becomes difficult for you to be of help to the other person. Instead of empathizing, you have become a sympathizer, and then you become a person that is not quite helpful to them.
Truly, it has happened. It happened last year when I lost my dad. it was a down moment for me, but I realized I was going out to give professional service, but when it came a time where I lost my dad, no one could come and give me a therapy on loss and grief until I went looking for it for myself. People knew that I'm strong because I've been encouraging others, have been there for members of the church, have been there in the society, consoling, bereaving with them, taking them through the loss and grief. But when it dawned on me, I needed somebody to hold my hand. Unfortunately, they were there, but they knew I know how to deal with it, which is unfortunate. That when we are professionals, we need also people to come on board, even remind us what we know, so that we can come out of it successfully and live a healthy life.
Yeah, a lot, because the community know that I know everything, I have money. So whenever there is an issue, they always bring the clients or the survivor to me to take care of them, maybe taking them to hospital, making follow-up, to an extent even going to court, because maybe it is a defilement case. So I have been having a lot of issues. Sometimes I go to visit a household, I find maybe a mother have 11 children, they have nothing to eat. At the end of the day, I have nothing to give to that household. So sometimes I'm very traumatized and I cannot sleep thinking about that household. Yes.
Yeah, I had many. Let me give you one experience. And actually, this is how I met Peter, my former husband. There's a day our church took us to Elder Maravin for a women outreach to the drug zones. And we managed to get one client that the church now handed over to me to take care of him in an inpatient setting. So I took him to Kajiado. In Kajiado, the rehab that they had chosen is where Peter was employed. That's how we met. So through this client, me and Peter journeyed together. But during his last week, when he's about to be discharged, the elder sister heard about him being in a rehab, and she was so happy she visited him. Without knowing, she gave him 1,000 shillings. Now, giving him 1,000 made the client jump the wall and disappear. So Peter called me and told me he was called John. John has jumped and we don't know where he is. Maybe if you can volunteer and look for him in Nakuru, could be he has come back to Nakuru. And actually I got him. I got him high, but I managed to carry him along to my house. And I tried talking to him to go back, but he refused. He refused. Then I called Peter and I told him he was high. Let me do in the morning. I go very early before he starts drinking. I see if I can get him. But when I went there in the morning, I found John had been stabbed by his drinking mates. He had a phone. They were struggling to take his phone and he was struggling to keep it. So one of them stabbed him. And that time, our medics had gone on strike. So there was nowhere they could take him. And he died there while they watched. So it traumatized me. Now I'm going in the morning to look for John. I see if I can take him back to the rehab. I find him dead. So that thing really traumatized me for a long time.
How the community can support us. One, they should accept that we are human beings just the way they are. We have feelings emotionally. We have our spiritual part. What they go through emotionally is the same what we go through. So they should understand. Number two, they should accept us as part of the society. They should not sideline us. They should not take us to a point whereby they feel we are at a different level. They should always understand that we are at the same level with them, only that maybe the knowledge we have and the grace we have for ministry is so different. Number three, they should walk with us on our journey. Sometimes they just accept us when we are walking with them through their journey. But when it comes to our journey, very few will come close. I don't know, maybe because of the perception of the society, the perception of the community, that touch not the anointed of the Lord. Sometimes it keeps them away. But I want to tell them the truth. These anointed, sometimes they pass through hell. And they just go back in their backyard and they just break down until somebody comes through to walk with them through the process.
First and foremost, I'd like the government to sponsor us so that we can do an awareness in the community. Wherever, you know, we are caregivers cutting across the whole nation. So if the county, the national and the county government can team up with such organizations, it will be easier for us to go to the community because we have our clients, we have the knowledge, we have everything on how to reach out to the community. And through educating them and sensitizing them, they'll be able to understand what we undergo. And again, through that, we can team up together to assist the community. Secondly, maybe the government can come up with areas where we as the caregivers, can be going. Like in Nakuru, I don't know if there is anywhere that I can go and pour out what I'm undergoing. So it's becoming difficult for me. I have to reach out in other areas, and it entails, again, financial constraints that are too much for me, being a non-profit organization. So if we can get a place in every county for every caregiver to be aware of, in case of such occasions, you can rush there and be assisted, I'll be so grateful.
The community have to understand that even if a person dies, needs our care, and there must be a person who will take care for those people. So when they hear someone is working in a mortuary, they should think like someone working somewhere else in an office. We are not different, and that mentality of them that we take something like something to make us high, it is not good mentality.
I would request the community to volunteer helping me in this organization, because we have a lot of girls who need those skills, and if they get those skills, it will be able to help them in their livelihood. So if I can find volunteers who can volunteer here, maybe the organization that do mental health, they come and help me in counseling the girls free of charge, because I don't have anything to pay them with. I also need funding so that I can be able to buy materials for this organization that those girls use day in, day out during their trainings.
As we implement our work, there's a number of levels of support. One, I look at this support as the community itself, the people outside there, and also the corporates or the government. From the government level, I would expect that they should improve and put more resources in mental health. Training of psychiatrists, training of psychologists, training of psychiatrists, social workers, occupational therapists, and all the persons that are involved in management of persons with mental illness. And if they do that, then the next thing they need to do is deploy them appropriately, so that they do not have to be concentrated only in certain urban areas, whereas even people in the rural areas need them. We also will be expecting the government, and that is the national and county governments, to be making serious investments in mental health in terms of infrastructure, because we will need places where patients can come, patients can be attended to, both as inpatient, outpatients. We will need facilities like halfway homes where patients can be placed before they can go back home, as they are trained how to reintegrate to their homes. So that is the level of government. But when it comes to the level of family and community, then we need them to be educated, to be able to understand what mental illness is about and be able to offer direct support to their patients who are sick by way of being there for them to provide emotional support, by way of providing them with medications. And that way, they will be able to bring them for care, whether to a psychologist, to a psychiatrist, and be able to make provisions for those services. If they do that, then the work of the mental health practitioners becomes easier, because you now see you have grown a team beyond the regular mental health team in hospitals that we see. I think that's the support I would expect from government at the minimum and from the community.
My parting shot is that I would encourage every professional, be it a pastor, be it a minister of the word, be it someone who is practicing, to have a personal self-care, because this is paramount. And an insight is of this last week where we heard through the news a practitioner, a nurse from Kiambu, who was practicing in a psychiatric ward, who committed suicide and left a note. So if people could be there for such a kind of us who are serving in a very serious and a very important place in a community or a society, they should come on board with us. Number two, each one of us should seek for counseling services. It is now not a Western kind of thing. It is here with us. Mental health is paramount. We need, each one of us is undergoing a situation, especially during this electioneering period. Everybody needs to go through this process, because that is then we shall be assured of a healthy society that is mentally sober, ready to run the events.
I like to tell them, working in a mortuary is just like any other work. Any other work you can work, because these people, or this after death, will need someone to take care of till you are buried. So the society have to agree and accept morticians who take care of them after they die.
I have come to realize that if you empower a young girl, there is a lot of things that that girl can do. She can be self-reliant. She can be able to take care of her children. So if we support those girls, I think the world will be a better place for them.
Let the community understand what we are undergoing. Many people think that I'm after money. I'm not after money. I've gone to hell and back. For me to do this, it's because of what I've undergone. Being in drug addiction for 28 years, I've seen a lot. And I wouldn't like anybody to undergo what I've gone through, especially women, female, because it's not a place to be. And when I see somebody suffering, I remember those days that I suffered in silence with no help. That's why I volunteer doing this work with all the passion and all my might, sacrificing my time and resources. So if I can get the community to back up what we do, maybe I'll have an impact to the community. Because right now, people don't really understand what I do. But if they open up and let me explain, it will be in a better position, not only to me, to all the caregivers around the nation.
Our parting shot is to remind people who will be listening to me now and in the future that there will never be health without mental health. So unless we take care of your mental health, your physical health will never be complete, your social health will never be complete. And so it's important that we invest time and resources in taking care of our mental health at all times. Thank you.
We are glad to work on this experiment. We are working together with organizations, Arcadian Counseling Center, Opportunities Across Continents, and Haven of Dreams. And we are grateful to the Funders Initiative for Civil Society and Global Dialogue for supporting by funding this exercise.